Hello viewers, you're welcome for today's section. It is my pleasure to have you here today. To all my returning viewers, you're welcome, and to the first time viewers, thank you for stopping by. Please do well to encourage this channel by hitting the subscribe button somewhere on your screen. Yes, at the end of last topic, why we should engage in regular health check, I mentioned that we'll be looking at what cancer is exactly, what cancer is all about, and here we are today looking at cancer. Now, growth, as they say, is natural, and it is a beautiful experience at that. But are all growth good enough? Of course not, right? This is in the case of certain types of cancers that result to the visible growth of cells known as tumor, contrary to other types that do not cause physical growth like leukemia. Naturally, there are body cells with particular functions and fixed lifespans, and are naturally expected to get instructions to die. This is called cell death, which comes with phenomenal benefits. In this case, the body has the ability to replace dead cells with newer cells in order to function a lot better. This entire phenomenon is known as apoptosis. When a cell becomes cancerous, the components that give them instructions to die and also to stop dividing disappears. And this makes them to live on, and at this point, they build up in the affected body, using up the nutrients and oxygen required to sustain other cells. Cancerous cells have the ability to alter the immune system. They also have the ability to form tumors and can bring about alteration that deprive the body from regular functions. Through the lymph nodes, cancer cells can spread from originated sites to other sites. Now, is growth actually a good thing? The answer is not in all cases. Well, in the embryo, we have growth which gears towards organ formation, as in the case of embryogenesis and organogenesis. In injured tissues, we have growth in the form of tissue regeneration, but in cancer, growth is very, very deadly. Different types of cellular growth include hypertrophy, which deals with the size of the cell. We have the hyperplasia, which deals with the increase in the number of the cells. We also have the metaplasia, which is all about the display of one type of tissue to another type of tissue in the same category of tissues. Example is from one connective tissue to another connective tissue, or from one epithelium tissue to another epithelium tissue. We have another type of growth known as dysplasia. It is abnormal or dysfunctional growth, but this type can turn or become a kind of cellular growth known as neoplasia, which is the same thing as tumor. Tumors can be benign or malignant. Neoplasia persists even long after what brought about the growth has stopped. Neoplasia is abnormal mass of tissue. Malignant tumors are cancers. They can either be carcinoma, which are of the epithelium tissue, or sarcoma, connective tissue. Now, when metastasis occur, carcinoma would go to the lymph, and the sarcoma will go to the blood. Cancer can either be polyclonal or monoclonal. Here, it is originated from one cell, just as a single cell. When it is polyclonal, it is derived from multiple cells. We only have risk factors for cancer and no evident cause. Cancer is known to be growth with no control and limits. Cancer has no beneficial function at all. It can spore from just any kind of cells. I know you would want to ask if there is a cure for cancer. Yes, well, CML can be taken care of by the use of imatinib. Combination chemotherapy can take care of ALL. Hodgkin's lymphoma can be arrested with ABVD chemo regimen, yes. Although 92% chances is what is guaranteed for this particular one. Now, basal cell carcinoma can be sorted out by the use of exceptional biopsy. Meanwhile, surgical resection can resolve the cases of a lot of stage 1 cancer. There are so many cancers without cure. Example is the pancreatic cancer. Malignant cancers are not capsulated, while benign cancers are. They have criteria for malignancies, but benign cancers do not have criteria for malignancies. In malignant cancer, recurrence is common, but not common in benign cancers after removal. In malignant cancer, metastasis is common and the rate of growth is very rapid. Meanwhile, this does not happen with benign cancer. And here, the rate of growth is very slow. Malignant cancers kill the patients, but benign cancers are not dangerous, but there are certain exceptional cases, Now, how does cancer kill people? The answer to this is that cancer kills through anemia, cachexia, organ destruction, obstruction of the biliary tree in the case of jaundice, and it's like obstruction of the intestine or ventricles. Metastasis, which is the spread from the spread of original sites to the other parts of the body. Paraneoplastic syndrome, and so on. Managing cancer can be done through different routes like surgery, radiation, blood separation, which is apheresis, chemotherapy as well. Cancer is malignant, we know. It has rapid cell division. Cancer is monoclonal. It metastasizes and it has the ability to crowd out. Breast cancer metastasizes to bones. Lung cancer spreads to the brain. Colon cancer likes to spread to the liver. This makes them predilectional. Cancer grows without limits, except it outgrows its blood supply. Cancer has no reasonable cause at all. It evades the T cells. We lack enough evidence to prove the cause of cancer for now. Tumors can be graded just as they can be staged. In grading assessment of tumor cells, it is done using the microscope, looking at the sizes, the shapes, the color, and arrangement to know if they are normal or not. Not all cases, rather, have the same grading system. We have the grade 1, which is the low grade, and cells here involved are well differentiated, Grade 2 is a moderate grade. Grade 2 cells are moderately differentiated. Intermediate grade, which is the grade 3, this is poorly differentiated and it is highly graded. Grade 4 is undifferentiated and is a high grade. Here, cells are extremely abnormal. On the other hand, which is staging. Staging is determined by looking at the variety of things like the MRI of a patient, the scan of a patient, the X-ray, ultrasound of a patient, and the laboratory results of your patients. Staging helps to develop treatment plan for cancer patients. It helps to provide insights on how aggressive, treatable or not the cancer case could be. It helps in clinical trials as well. We are going to pause here for today, and on this note, thank you for staying till the end of this video. Please subscribe and hit the notification bell for an alert for the next coming video. Share and make comments, please. Thank you. Hello viewers, you're welcome to Dr. Buchi and Purpose channel. Here I create comprehensive, easy to grasp lectures for students and non-students. My lectures are detailed and easy to assimilate. I also share useful academic information, career, job opportunity tips, lifestyle and health talk. If there are topics you want to be discussed here, please do well to mention on regular basis.